Welcome to the Arden Cancer Centre. This short video will take you through the steps of your radiotherapy treatment at the centre. We are part of the University Hospital Coventry and Warwickshire NHS Trust. The Arden Cancer Centre is situated to the left of the main hospital entrance. We are a very busy and large hospital, and at times parking can be difficult. Please allow plenty of time to find a parking space. You are entitled to free parking for all of your radiotherapy appointments. Some patients prefer to travel by bus, and there are several bus routes that stop in front of the main entrance. When you first come to the radiotherapy department, it will be for your radiotherapy CT planning scan. On arrival, you will check in at the Arden Centre reception and have a seat in our waiting room. The waiting room has a refreshment kiosk which is open from 10 AM till 4 PM. The purpose for the CT scan is so that the doctor can decide the exact area that they want treated. A radiographer will come to collect you from the waiting room and take you through to have your scan. It is just like a normal CT scan, but there might be some preparation needed beforehand. This depends on the area that we are treating, and any preparation required will be explained to you before your CT appointment. Before you are taken in for your scan, the radiographer will have a chat with you to inform you about what to expect. During this chat, we will check that you have given your consent for the treatment. You will also have opportunity to ask any questions that you may have. After the radiographer has gone through all the necessary information, you will be taken into the CT scanner room. Once you are inside the room, you will need to remove your clothing just from the area that we are planning to treat. It is very important that during both your scan and radiotherapy treatment you lie still. To do this, we may use equipment to ensure that you are supported in keeping still and comfortable. You can breathe normally throughout unless you are told otherwise. Once you are lying down, we will begin to take you closer to the scanner and use laser lights to get you lined up in the correct position. We will then draw pen marks onto your skin and take measurements so that when you come for treatment, the radiographers can ensure that you are set up in the correct position. During the CT scan, radiographers are not in the room. However, they can see you at all times. The CT scan only lasts a couple of minutes. Once it is completed, the radiographers will come back in the room and put tiny little permanent tattoo dots onto your skin if needed. These tattoo dots are to ensure that you are set up correctly for radiotherapy treatment. After this, you'll be able to get dressed and the radiographer will give you any remaining information. Due to the complexity of radiotherapy and the planning process, it can take up to 4 weeks for you to receive your first radiotherapy treatment appointment. During this time, the doctor will use your CT scan to highlight the exact area that they want to treat. After this, physicists, dosimetrists and radiographers will carefully plan and prepare your treatment to determine the exact dose and technique required for you. When your treatment plan is ready, you will receive a phone call informing you of your first day of radiotherapy treatment. Please arrive and check in at the Arden Cancer Centre 15 minutes before your treatment time. If you've been asked to prepare for your treatment, please ensure that you have done so. Radiotherapy treatment is delivered by complex machines called linear accelerators. You will usually be treated on the same treatment machine every day by the same team of radiographers. We have both male and female staff throughout the department. As we are a teaching hospital, we have student radiographers who work in radiotherapy and are supervised by qualified and experienced radiographers. There are TV screens in the waiting room which will inform you of any delays on your treatment machine. If in doubt, ask at reception. When we are ready, a radiographer will come and collect you from the waiting room. Before going into the treatment room, the radiographer will talk to you about what to expect. Here, they will ask you to confirm your name, date of birth and address. This will be asked every day before treatment as it is hospital policy. Once all the required information is given to you, the radiographer will take you to the treatment room. Once you are inside the room, you will be asked to get into the same position as the CT scan. Once you are lying down on the bed, the radiographer will use laser lights in the room to line up your tattoo dots. This is to ensure that you are in the correct position for treatment. Once this has been achieved, the machine will begin to move around you. At no point will it touch you, and you should not see anything or feel anything. The radiographers are not in the room during treatment, but they can see you at all times. Before treatment can begin, the radiographers will take images to check that the treatment is delivered to the correct area. Patients are usually in the treatment room for around 15 minutes. Most of that time is ensuring that you're in the correct position for treatment. The treatment itself only lasts a couple of minutes. On the first day, the radiographers will give you your full list of appointments. This may include reviews with your doctor, specialist nurse and Macmillan radiographers. Reviews are an opportunity to talk about your treatment, any side effects, problems, worries or concerns that you may be experiencing. Any questions or problems that may arise during your treatment, please ask the radiographers and they will do their best to help you.